welcome to our webinar, What You Should Be Doing While Waiting for Your Written Marks or Results to Come out. So thanks everyone for joining me today. I'm really excited to go through the material because I do find that this is such a, how should I put it? A terrible time for so many students. There's so much anxiety around waiting and that kind of uncertainty. And then there's that added kind of, anxiety around the fact that do you take the June practical or do you take November? So, it's kind of hard. And you even get into the situation after the March written, you really need to make that decision. Are you going to take the June or November practical? So I'm really excited kind of to take you through the material today and explain to you how you can be a little less stressed during this time and how you can make the most out of this time. So before we begin, I just want to get a show of hands, if we can, to just make sure everyone can hear me. So for those of you who are watching the recording of this, bear with me here. Otherwise, for everyone else, I'm just going to get you to raise your hand if you can hear me. Okay, good. Getting lots of people raising their hands. That's awesome. Also, feel free to type in the chat box and just say, yes, I hear you. I'm ready. Okay, a few other things that I want to go over today is I just want to get an idea of how many of you took your exam in November. So please just type in the chat box. If you did, just say, yes, me. Perfect. Okay, if you didn't, please type in which exam you're planning to do. So there's still quite a few of you who didn't type something in, so I just want to get an idea of where you're all coming from. Okay, so definitely some marches here. Okay, so this will definitely speak to, some of you who are preparing for other exams. And those of you who are watching the recording of this as well, this is going to be applicable to you when you are waiting for your marks to come back for the written, and you're trying to decide whether or not you should do the practical component, kind of register, or wait for your marks. All right, so before I begin, I'm just going to go over a review here that we got on Google. Now, if you're watching this or attending live, please do go leave us a 5-star review. It does allow us to do these free webinars for you. So the more reviews we get, the easier it is to provide more free content. So this is from Tiffany. She studied in Australia and said this is the best place to go to study for the written and clinical exam. Everyone is professional, knowledgeable, and has great energy and is just willing to help. So thanks so much, Tiffany. That's such a nice review. And again, we really, really appreciate any comments, feedback that we do get from you. All right, so for those of you who don't know me, I am Caitlin Proctor. I'm a Canadian trained physiotherapist from UBC. I am the founder of PT Exam Prep, and my main role is to create content for students like you. And what I mean by creating content is going through the recent updates from the Canadian Alliance of Physiotherapy Regulators, going through the most, or going through content that we know is highly examinable and breaking it down into chunks that are easy for you to learn, okay? On the side, I also work in private practice in orthopedics. Okay, so alas, the first topic that I want to go over today is that I want you to review topics that you remember from your exam. So are there topics that you remember leaving the exam and thinking to yourself, oh my goodness, I wish I would have studied that? I want you to go and study those now, okay? So everyone leaves the exam having a few questions that they just remember being difficult. And the key here is that you cannot share these. So these may be topics that you found difficult, but you cannot share this with anyone. You cannot tell anyone about anything that happened on the exam. You signed a confidentiality agreement, so super important that you abide by that. But what you can do is you can use that knowledge to then go and refine your knowledge. So if you find that there's something that, I put something up here about carpal tunnel. If you are like, oh my gosh, I remember there being some questions on carpal tunnel and I just felt like I could have studied that more. Now is your time. That material is still fresh, okay? If you don't remember anything on the exam, you just kind of black out once you leave. I get that. That is me. Try doing a few mock exams. Go back to our Instagram posts, to the mock exam Monday questions, and see if anything triggers you. If you're like, oh, yeah, I remember that being on the exam, then go and study it. And make sure that you prioritize studying them now. Okay? So, my next tip for you is a bunch of topics that we're going to review. So what we're going to do is we're going to go over my must-know topics. Now, what's important about these must-know topics is they're applicable for the written and practical. So you're going to see a theme all towards or all through kind of the presentation today, and that is you aren't going to waste studying right now. Studying is great, and remember, if you've ever been to a webinar, you've probably heard me say the practical is still 25% written. So it's really important to stay on top of your topics from the theoretical studying portion of it. So these are topics that I think you absolutely must know. So we will cover joint mobilization, COPD, brachial plexus, and infection transmission today. But some things I really want to draw your attention to is the gait cycle. Know your phases. Know which muscles are activated. Special tests. This is, basic and entry level. Make sure you're sticking to those tests. Don't go and do these, weird these special tests that no one's really heard of. Stick to the big ones and know them. And the difference between studying for the written and practical, which we will talk about a little bit later, but you want to make sure that you know the fine, minute details. Theoretically, you are able to, acknowledge them if they were written out. Versus in the practical, you want to know step by step how to go through them. What do you do if the patient has pain? What do you do if the patient doesn't have pain? What type of questions, what type of wording do you want to use as you're doing these special tests? And these are things that we cover in depth in the practical course, but it's really important that in this time, you're making the most of it, right? So go through special tests, especially for those of you who live in British Columbia and are working as an intern physio. The reason why I say British Columbia is that British Columbia is the only province that you can work as an intern physiotherapist before finding out if you passed for your written. So you're a special subset of physios that can actually practice right now. So if you are practicing, make sure you're doing these special tests and sticking to like the real textbook way of doing it so that it transitions well over to that practical exam. Okay, next are contraindications. Contraindications are so important. You need to be able to, again, identify them or list them in the theory versus in the practical, you need to be able to state them. Okay, and we will go over this a bit more. And red flags, mandatory questions. Super important to know for both exams. All righty. So first off is joint mobilizations. What I want you to do here is I want you to write down 3 indications for joint mobilizations and put them in the chat box for me. Now, if you're watching the recording of this, I want you to take a few seconds here and write down on a piece of paper the indications. I know sometimes it can be annoying to actually go and do these activities, but seriously, it's so important to assess your readiness. If you did your written exam, you should know this, okay? These should be coming to you really, really quickly. So there's not very many people, to be honest, in the chat box that are giving us an answer here. So this, to me, is going to be a big circle that I want you guys to highlight, something you need to focus on right now. So let's look at our indications. So decreased passive movement, that's a great indication for a joint mobilization. An early capsular end feel or mechanical pain. Okay, some of the other things that I'm getting here are muscle guarding, which yes, you could do, and hypomobility. Great. Okay, what about precautions? Now I'm going to give you 1, 2, 3, 4, 5, 6, 7. Can anyone write maybe 3 precautions? So not contraindications, precautions to joint mobilizations. Again, write them in the chat box if you're joining me live or if you are watching the recording. Please write it down on a piece of paper and really do use this time to assess your readiness. Okay, let's go through the answers. So impaired circulation or sensation is definitely a precaution. This is not necessarily a reason not to do it, but it is a reason to check in a little bit more often. If they have compromised bone health, again, something you want to pay attention to and really ask your questions. So, have they had fragility fractures? Do they know if they have osteoporosis? Sometimes patients don't know. Have they had a bone mineral density? Is there any indications that they may have it? So, are they on any type of steroid, prednisone? If they have a clotting disorder, poor skin conditions, open wounds, if they have discomfort in the treatment position, this is something you need to be careful of. And yes, you would need to change your treatment or kind of therapeutic position for the patient. Or if they have a marked skeletal deformity. Now, this is a precaution because you do need to adjust your treatment based off of how the patient presents. I don't expect there to be any patients on the exam with any type of skeletal deformity. Remember, this is a standardized exam across Canada. So they got to make every single person have either the same question on the written, or they're going to make every single student perform the same station, which means that every single student would have to have that type of answer. And it's pretty hard to act a skeletal deformity, but important to know it is a precaution. Okay, let's go on to contraindications. Now, I really feel strongly that everyone here should be able to at least list 5. Again, if you are joining me watching this recording, I want you right now to write down 5 and be hard on yourself. Make sure you're doing 5. Now, one of the common questions I get as you're kind of thinking through this is, how many contraindications do I need to state on the practical exam? It's a good question, and we do kind of give 2 differing answers for this. Number 1, we always say pick 5. 5 is a great number to be able to say, and of course, keep them relevant. So if you have a pregnant patient, you're going to make sure you cover the contraindications for pregnant patients. But the marker may stop you after a few, or they may not stop you. So be prepared to keep going. If you know more, say more. If you're unsure, don't say more. Okay, let's review this. So the big one here that I want to go over, we have fracture, local, not healed, acute inflammation, we have instability, hypermobility in the direction of the mobilization. So if someone does have too much movement, you wouldn't want to mobilize in that direction. Bone or joint infection, spinal cord signs and symptoms. So what are spinal cord signs and symptoms? Can anyone answer this? We'll give a shout out to the student who gets this right. Got two more seconds to put in your answers. Maybe we're not going to get a right answer. Okay, so when we're looking at spinal cord signs and symptoms, we really are looking for those kind of cauda equina symptoms, so loss of bowel or bladder, bilateral symptoms. Can anyone say the last one? Saddle paresthesia. Okay, so that's one of them for sure. And then other spinal cord sign and symptoms that we want to be careful of are things like, loss of reflexes. Okay, so we also have spasm. We have bony end feel and empty end feel, and lack of patient consent, obviously, right? So hopefully that makes sense to everyone, and it makes you realize the level of detail that you need to know for joint mobilization that is applicable for both the written and practical exams. So again, everyone who's joining me a little late right now, the big thing I want you to take away from this is don't waste this time. I know you're exhausted from studying. Trust me, I have been there. I have done the same exams that you have done. So I do have credibility to what I'm talking about. And I do know that it's very easy to just kind of get back into the habit of not studying or, regaining your life again. But here's the thing. If you aren't successful in your exam, you want to take the written fairly soon. You have this momentum, you have this knowledge in your head. Use it and take the exam soon so you don't have to waste that knowledge. On the flip side, if you pass, we want you to keep that knowledge and keep this momentum going. Take the next practical exam and go for it. But again, don't waste this time. So regardless, this kind of in-between time is super important. Alrighty, next thing we're going to talk about here is COPD. So you should know the presentation, diagnostic criteria, treatment, and HEP means home exercise program, as well as systemic consequences. Now let's talk a little bit about both. So emphysema, we know it's that permanent destructive enlargement of air spaces distal to the terminal bronchioles without obvious fibrosis and with loss of normal architecture. So we call this pink puffer, okay? If I'm reading this to you right now, as I read it kind of word for word from the screen, and it doesn't really make sense to you, star this, highlight this, write it down as a topic that you are absolutely going to cover. COPD is so highly testable. I don't want anyone leaving here without definitely understanding what COPD is and what the difference is between emphysema and chronic bronchitis. All right, so if we look at chronic bronchitis, we know it is characterized as the presence of a cough productive of sputum, not attributable to other causes, so like, like a cold, on most days for at least 3 months over 2 consecutive years. So let's test your knowledge and see if you actually understand the difference between them, okay? So I'm going to give you 1 minute. I want you to write either increased or decreased in each of these boxes. And I want you to tell me, are they increased or decreased with COPD? Alrighty, I'm going to put my timer on and I will stop talking for 1 minute. Okay, let's go through the answers here. So we will see an increased respiratory rate in patients with COPD. Now remember, they're hyperinflated. I love giving this example to students. Think about it as if you're breathing at that very top of your tidal volume. So everyone do this with me. Take a big breath in, okay? Now with that breath in, blow out maybe 20 to 30% of your air. Now hold that. And I want you to just breathe at that increased lung capacity, okay? So you're definitely have a lot of air still in the chamber. You breathe a little bit out. And now you're breathing at that really kind of upper amount of air. So that's what hyperinflated means. You have all this air that's still stuck in your lungs and you're trying to breathe there. Now, what did everyone do? Did their breathing rate slow down or increase? Yeah, exactly. It increased. So in respiratory rate or with COPD, we're going to see the respiratory rate increase. And the same thing goes with our heart rate. Now, if we think about O2 saturation, what's going to happen here? We know when we go into that hyperventilation state, what happens? We breathe off a lot of CO2. So we are going to have a decreased oxygen saturation rate. And kind of to keep following this pattern, if we look at our ABGs, we know that this is going to cause acidosis. And with acidosis, we know this means a decreased pH and an increased PCO2. So here are the answers for everyone. We have increased respiratory rate and heart rate, a decreased O2 and pH, and an increased PCO2. Hopefully that made a lot of sense to everyone. And again, try practicing at that different lung volume with that hyperinflated lungs. It really does show you a lot of practical explanation of why these patients do have this presentation. Okay, next let's look at the diagnostic criteria. So here I've shown you the lung volumes and capacities that we typically look at. So we have our forced expiratory volume for 1 second, forced vital capacity ratio, total lung capacity, functional residual capacity, and residual volume. Now, I want you to take a second here and write down whether each of these will be increased or decreased for COPD. I won't give you quite as long for this. And I'm actually going to be a little bit cruel, and I'm not going to go through the explanation for this either. I really do feel like this is entry level knowledge. And if you are sitting here right now after doing your written exam and you don't know the answer to this needs to be something that you go and spend time reviewing, okay? And again, something that will be important for your practical exam too. So this information needs to be circled if you're watching this right now and you're not really sure what the answer is. So we are going to have a decreased FEV1 and ratio in COPD. We are going to have an increased total lung capacity, functional residual capacity, and residual volume. So the bottom three will be increased and the top two will be decreased. All right, let's keep finding holes in your knowledge. So for a treatment and home exercise plan, what would you suggest? Now, there's one thing that I want you to take away from this, and this is that it definitely could be a written type of question, but it also could be a written question on your practical exam where you do have to write down potential treatments and home exercise program. You also may have to verbally go through this with your patient. So again, really important to have this quick and at the tip of your tongue. So the number one treatment that everyone should get here is a smoking cessation program. So if you do have a patient with COPD, you can ask if they smoke, and if they do, that is your first line of defense, is we need to stop the patient from smoking. The next treatment that we often see is medical in nature, and that's an inhaled corticosteroid or sometimes even oxygen supplementation. Now, for home exercise program, what's the one breathing exercise we want to teach to all of our COPD patients? Awesome. And a lot of you guys are getting this right now, so that's great. And that's pursed lip breathing. Remember, when you do pursed lip breathing, which is that kind of like you're blowing out a candle or you're creating that back pressure, is that you're actually opening up the alveoli and helping the patient get that air out so that they are no longer hyperinflated. Okay, next is systemic consequences. I'm going to test your knowledge again. Now, I want you to tell me, are each of the following increased or decreased with COPD? I will give you 1 minute to go through this. Okay, let's review the answers here. So from seeing what people are typing in the chat box, it seems like most of you are getting these again. So I'm really, really impressed. Let's take a look at the first one. So with VO2 max, we are going to see that this is decreased. We know that the patients are going to have a decreased ability to, uptake oxygen. So naturally, VO2 max will be decreased. Next, if we look at the risk of osteoporosis, we know this will be increased. And again, if we can kind of tie this full circle, remember when we were talking about joint mobilizations, we talked about bone health or bone compromisation to be a potential precaution for joint mobilizations. Now, what about this patient makes us think that they could have this bone compromise or compromised bone? Exactly. The fact that we know that they're often treated with corticosteroids. So, again, we know in this population that their risk of osteoporosis is higher. Now, depression, this is a kind of a quality of life score here, and we often see it decrease in patients with COPD. Next, if we take a look at muscle force, and this one can be a bit confusing to students, but we're really looking at that muscle force of your accessory muscles. And we know it's going to be increased with these patients because they are having to work so much hard to breathe. Okay. That's usually one where people get a little bit confused with. Next, cardiovascular disease and feelings of fatigue. Oh, we know this is kind of a terrible feed forward cycle. So we know that this is going to be increased as well. So here's all your answers to those. Okay, let's keep going. My next topic that you must know is the brachial plexus. Now, I'd love for you to know any type of mnemonics. And again, if you're in our written course, you've definitely seen a ton of mnemonics around the brachial plexus in our anatomy guide. Um, but I also want you to know your functional expectations. So, what would be affected if there was a laceration to the superior trunk, or if there was a nerve root issue or compression at C5? You need to be able to draw this brachial plexus out for sure for your written exam. So if you don't know this after, if you do have your written exam coming up, then make sure you know this. For your practical exam, it's a little less likely that you would have to know this level of detail. However, it's really helpful for these terminal branches, and it's going to give you more information on what you would expect the patient to present with. So really, really nice to know for the brachial plexus. Now, does anyone know the acronym that we have here for, let me see if I can find it, for the posterior cord? So we know on the posterior cord, we have the upper subscapular, lower subscapular, which is for S. We have our thoracodorsal, which is for T. We have our axillary, which is A, and our radial is R. So you have your acronym STAR for the posterior cord. Pretty cool, hey? Does anyone know that? Yeah, awesome. Okay, let's give you another hint. Next is knowing about infection transmission. So you should know contact precautions, droplet precautions, and airborne precautions. Now, I want to test you a little bit here. Again, you know you need to know these precautions, but what equipment would you don and doff for each precaution? So I'm going to give you a minute and a half for this, and I want you to write down beside contact, droplet, and airborne what you would follow or what you would wear as you go into the station. And for bonus marks, let me know if you think the patient should or shouldn't be in a private room. A minute and a half starting now. Alrighty, let's review this. So let's take a look at what we would do for contact precautions. Now, with contact precautions, we're going to get the patient in a private room wearing gown and gloves. For droplet precautions, we're again going to do a private room, wear a mask, gown, gloves, and goggles. So notice you're wearing the most with droplet precautions. However, with airborne, we are going to get them in a private room and use an N95 mask, gloves, and gown. Now, I want to take this information and put it into an example practice station and an example written station to show you why this information is so important to consolidate, whether or not you have to take your written again, or if you have to go on and have to, if you get to, go on and take your practical exam. So let's look at a station. This is going to be a 5-minute station. Your cystic fibrosis patient has MRSA and has orders for chest therapy. Perform the proper donning and doffing of equipment for this patient. Now, I'm going to give you 30 seconds or so to think about what you would do in this situation. Please write it down. Now, again, if you are watching the recording of this, make an effort. If you want more than 30 seconds, if you want maybe the true 1 minute you would get in this station, then take it. I really do want you, though, to think about exactly what you would do for this station. This is the best way to test your knowledge and find out, do you really get it, or do you need to work on this information? Okay, let's review this. Now, here's the trick with this question. You need to know pathology specific precautions. So they may not exactly say contact or droplet precautions. They may say a condition like MRSA, and you need to know which precautions to follow. So in this situation, there is a certain subset of precautions we need to follow for MRSA. However, you need to perform chest therapy. So this changes it. So since the patient has MRSA, you would normally not wear a mask. However, since you are performing chest therapy, or bronchial hygiene is another way they may say it, a mask and goggles are required. So we go into droplet precautions. Now, another question we get around this is that, how do you do your hand washing in the station? There will likely not be a sink in the station, but there will be hand sanitizer. So use your hand sanitizer as if it was your sink to wash your hands. Okay, let's see how this exact information could be seen in a written station. So I'm going to give you 1 minute to answer this, and please put your answer in the chat box. Um, and again, if you're watching the recording of this, I know I sound like a broken record, but please take your time and go through the practice of answering this question. Okay, how did that go for everyone? Most of the people that are attending this live got this right. In fact, I think everyone got this right. Maybe one, I see. Okay, so let's go through the answer. The answer here is droplet precautions, right? We just kind of went over this. We know through looking at the station again that we need to follow a certain set of precautions. And it's not necessarily what you would follow for MRSA because we know we're doing chest therapy or bronchial hygiene. So I reiterate one more time, if you did not get this question right, or this was a new learning opportunity for you, regardless of if you are going to pass your written and go on to the practical, or if you do, hopefully not have to take that written again, this is a type of information that is so important for both types of stations. Okay, I'm gonna give you some homework. So for those of you who are watching the recording of this, you can send us an email to info@ptexamprep.ca and I will send you the answers to the homework. But for everyone who is joining me tonight, you are going to get sent this in the webinar takeaway emails. So what I want you to do is I want you to write down a list of pathologies that you would see for contact, droplet, and airborne, and make sure you memorize these. Now, you don't need to send me your answers. I will send them to you if you are attending this live. Okay, we're almost there, everyone, so stick with me. The last kind of few things I'm going to go over is some techniques to help you prepare in this kind of terrible time, and that is stress management techniques. So master these now. I can't tell you how many students I've talked to that have had a really traumatic experience with the exam, whether it be from the written or the practical. Everyone has a story that you will relate to after you finish the exam. With that being said, know that this is going to be a stressful time and you need to be proactive. If you found the written exam stressful, you need to get on top of this now, okay? If you found yourself maybe not performing as well as you thought you would, or you found your emotions kind of get away from you, this is when you need to get on top of those emotions. Now, whether you are going to take up yoga or tapping or chanting or breathing, you need to find your poison. And that's what I mean by this. What is your poison? What is going to be your tool that when you get up to read a station and you start to panic, I want you to tap in to those fundamental stress management techniques that you mastered in this kind of downtime. I know for me, visualization was huge and breathing was huge. And I know it sounds silly, but seriously, take some time, learn to meditate, take some, like literally YouTube it, find something and tap into that peace. Find a way to find a way to bring your stress down within seconds. And really, breathing is found to be one of the best ones. So as silly as it sounds, there's not a single person I've talked to that isn't stressed about this exam. So please manage those techniques and learn those techniques right now. Okay. Next, I want to talk about starting to study for your practical. Regardless of how you feel you did, start studying for your practical. I'm going to say this again. Regardless of how you feel you did, start studying for your practical. This will allow your brain to learn the material in a different learning style. You won't be wasting your time, I promise you. In the event that you do fail, this information is not wasted, okay? You are going to have learned this material through a different kind of means of processing. Typically, studying for the practical is a more hands-on way of studying, and it's a more hands-on way for your brain to wrap your head around the material. So potentially this is one of the reasons why you're not getting through the written, is that you really do need to change the way you're mentally understanding and learning this material, okay? So here's the question that I know I'm going to get asked a million times, and that is, if you want to take a practical course, what happens with your results? So upon registration for a practical course, if you do not have your written results yet, let us know you are waiting for your results. We will hold off sending you your materials. Now, if you fail, if we can fill your spot and the course has not started, we can transfer your registration to the written course or the next practical course. And why I say if your course has not started is because some people may be watching this and they may be taking, maybe the March exam. And typically with the March exam, you're not going to find out your marks before you have to start studying for the practical. So that's a bit of a trickier situation. But for all of you who are doing November, I highly suggest start studying for the practical now, and know that you do have the option to potentially defer if we are able to fill your spot, your course has not started, and we have not sent you your materials. Now, what if you pass? We will send you your materials and you can get started. Now, we have a very different way of preparing students for the practical, and I will talk about that in a few seconds. But I just wanted to show you a picture I took today from the Canadian Alliance of Physiotherapy Regulators, and it's showing you your countdown. So we're looking at around 26 days for written and 61 days for the practical. So we're looking at about 2 months from now for the practical, okay? So beginning of February. And we're looking at about 26 days. So we're looking at the end of December. Okay, so to give you an idea, we do see sometimes that the scores get released slightly earlier, but this is usually fairly accurate. Okay, so what's included in our practical course? I'm going to go through this pretty quickly, and then I'm going to tell you about our upcoming webinars so that you can mark your calendar, and then I'm going to answer some questions. Okay, so in our practical courses, we have both face-to-face and virtual options. So if you do live in the Vancouver area, Calgary, Edmonton, Ottawa, or the Toronto area, we will have options for you. If you do live a little bit further, so we usually say if it's more than 3 hours to get to that location, then you can take the virtual options. The course material is exactly the same. It's just presented a little bit differently to facilitate either virtual learning or, of course, face-to-face learning. So you will get your course manual, and we teach you the framework method. So the framework method means that we are going to give you step-by-step guide of how to get through all the major stations. Now, this is the time right now that you need to be memorizing those frameworks. It's so important because once your course starts, you want to be having your teacher assess you. So seeing how you have used those frameworks, using them within the station. And that's when we can give you tons of feedback about what you need to improve on or what you're doing really well. So this lull time between your written and practical, written marks should really be spent studying your frameworks, okay? You also will get your anatomy, sensation, and mobility manual. And this is when you want to start going over all those topics that I listed, okay? Again, your, sorry, I have a cough. Your studying is not lost. You are not going to be wasting studying for the practical. This exam or the written exam is still very practical focused. So please, please, please don't feel like if you're studying for the practical, you're wasting your time. It will only help you learn the information a bit of a different way for your written. Okay. Next is you'll have a study group. The study group is pretty much a guaranteed group of people who have a common interest to pass the exam, are taking the course at the same time as you, and they obviously are dedicated to passing because they are taking a course. Our students are students who care. They want to pass. They want to get through it on their first attempt or whatever attempt this is for them. They want to get through it. So seriously, the students in our program are great people to work with. Next, all of our teachers are Canadian trained PTs. So you're going to get the tips and tricks that you need to pass the exam. We have over 30 hours of videos for you to watch and re-watch to explain situations, explain techniques, explain different scenarios and practical questions. And you also get individual feedback. I'm going to sneeze. Excuse me. Oh my gosh, I sound like a sickling here on this webinar. I'm not. But you also get individual feedback. So you'll really know after each session what you need to go work on, what you need to improve, and what you're doing well. Okay, our next webinar coming up is Ethical Scenarios Explained. It's coming up pretty quickly. It's on December 12th, and it's a great webinar again for our written students and practical students. So this is a free webinar, so please feel free to mark your calendar and know that it'll be me again going through this material with you. And last, if you want some more free material, head over to YouTube. If you are watching the recording, you've already headed over to YouTube. But I will be posting this on Thursday this week. So Thursday is December December 5th. So I will be posting it on December 5th around 5:30 Pacific Standard Time. So you can re-watch this webinar if you want. One of the very few webinars that we do post again. Okay, let's answer some questions. So I'm going to head over to the question box. For those of you who are joining me for the recording session, we will end here, but feel free to post any questions in the comments or email us at info@ptexamprep.com. Otherwise, I'm going to stick around for the live students and answer any questions that you have. Thank you.